Welcome to the amazing county of Kilifi. The magnificence of the county of Kilifi can only be described by its beauty. Located on the lower coastal regions of Kenya, Kilifi County has over 1.2 million inhabitants that call this place home. With its vast pristine beaches and large evergreen plantations, Kilifi County will marvel you. Under the stellar leadership of Governor Emerson Kingi, Kilifi County has made great strides in service provision for its residents, especially in the health sector.
Malengo yetu katika kitengo cha afya yanakuja kidaraja, in steps. Kwa hivyo kusema kweli, ikiwa tutuliza ndani ya miaka 2.5 ya ugatuzi ya kuwepo kwetu, ikiwa tumetimiza malengo ambayo ilikuwa tunataka yatimiza ndani ya miaka hiyo, basi kusema kweli jibu ni ndio.
Kilifi Health Department is first of all within the constitution is mandated to take care of health services within the county. So devolved services to county government system has given a mandate to the health department first to take care of health services in general. This in mention would be health facilities that we run, previously run by the national government. We have a function to also run public health activities within the county. We also have a function of ensuring that the pharmacies or pharmaceuticals are provided within the facilities. We also have functions of managing the resources that have been deemed for the health department.
Challenges in areas that had been struggling before the advent of devolution, like low patient numbers, high staff turnover, poor medical and financial records, lack of continuous professional medical training, access to quality and affordable drugs and medical supplies, and other infrastructure in the health sector have all seen a remarkable turnaround in the past 3 years.
Kabla ugatuzi ulikuwa ukiingia Kilifi, utapata mama wawili wamelala kitanda kimoja, wamejifungua wamelazwa kitanda kimoja. Hilo sasa tunalizika katika kaburi la sahau.
We inherited the system as it's running, but of course with challenges. Infrastructure challenges. This is in terms of the health facilities, the equipment that we had running over time, systems that were running then.
The department, when we inherited it, had a lot of challenges from the national government. We had issues of personnel, we had issues of infrastructure, we had issues of pharmaceutical products and non-pharmaceutical products. So it was a department kind of a shambles, but now I think we've brought it together and it's growing at a very rapid rate in terms of service delivery and also infrastructural development.
The county government of Kilifi Health Department has, in response to the Kenya Vision 2030 imperative, put to use the public-private partnerships and collaborations with various stakeholders in the achievement of the long-term goals. They have forged important partnerships that have allowed them to widen their scope in health to be in sync with the United Nations Sustainable Development Goal number 17. These partnerships gave birth to the inaugural Kilifi County Health Department Surgical September that took place across the county at various hospitals.
This is an initiative that we developed as a department that we have dubbed as the Kilifi Surgical September, in the sense that we want to have direct intervention to the patients or clients, away from the norm of seeing these clients in the health facilities.
One, we had a very long list of the patients who are awaiting to be operated. One reason was the list prolonged because most of our people cannot afford to undergo surgeries, and also the distance that some of our patients were coming from. And we sat as a department and decided to bring partners along so that they will help us have a surgical camp for treating our people in Kilifi. Sincerely speaking, with the help of our Public Service and Devolution Department, through the sub-county administrators, we were able to bring people from all the 35 wards, from all the villages. For the people who are, majority who are listed as beneficiaries to be operated, and also new clients that we got along the camp.
Surgical September was launched by Governor Emerson Kingi, who reiterated his county government's commitment to having a healthy and productive population in Kilifi County.
Katika bajeti zetu tuhakikisha kwamba tumeweka enough pesa ya kutosha ya kufanyia training, ili tupeleke madaktari wetu waje na ujuzi zaidi, tupeleke wauguzi wetu waje na ujuzi zaidi, ili kuhakikisha kwamba sekta hii ya afya tumeweka katika mikono ambayo ni ya watu ambao wanajua wanafanya kazi gani.
The week-long exercise that involved specialized teams of surgeons, doctors, nurses, and caregivers doing back-to-back surgeries in various hospitals across the county.
Kilifi itapata madaktari wageni wapasuaji 33 ambao watakuja kuwa na sisi kutoka kesho mpaka Jumamosi.
We are here today to launch our medical camp and surgical camp. The camp is here so that it can improve the health of common mwananchi. The camp will run for 1 week, whereby the first 2 days we are going to offer services on the ground, and the 3rd day and the 4th, 5th we shall have surgical camp in the hospitals. And the camp for surgical will take place in our 3 main hospitals, that is Kilifi, Malindi and Mariakani.
When you go out for outreaches, these are very different from the other outreaches. The other outreaches normally they only contain the reproductive health component, namely family planning, you'll find immunization, you'll find antenatal care. But when you go out with Beyond Zero campaign mobile outreach, when you go out there, we carry all the expertise. We actually move around with all the cadres, namely the nutrition, we have physiotherapy, we have occupational therapy, we have medical officers, we have clinical officers. So we have a blend of all the health workforce in the Beyond Zero. This makes it very different, and the community down on the ground really appreciate it because they're able to get all the services like a supermarket and like the other outreaches that, you know, are mainly focused on reproductive health and immunization.
Here we are at the Karisa Maitha grounds. We have come up with the initiative to reach out to people, expert movement, expert approach towards service delivery, so that instead of patients or clients coming to the facilities, we are also looking for ways of getting to the clients as they are equally down there. So this is an initiative that we are putting through that will be running every year.
The biggest partner in this exercise were the Surgical Society of Kenya, who partnered with the county health department to provide as many as 30 specialist surgeons to operate on cases that had been pending for quite a while.
Every year we purpose to do a surgical camp in one or other of the counties in the country. The best model for us is to work with county governments. And this year we are very privileged and thrilled to have to work with the Kilifi County government. The reason we are thrilled is because I think we know what the county is doing in terms of bringing to the fore the health issues in the county. And we are thrilled because this is a perfect alignment of what we want to do as a society and what the Kilifi County is doing.
Because of the heavy load of surgical patients in this country, because we are still very few surgeons in this country, we work with the county government to ensure at least that when we come, there will be cases which routinely would be a heavy load to the resident surgeons, but also there will be some cases which maybe we need some special service because we have all surgeons of different specialties who are members. That is one, and that is the mandate which brought us here to work in Kilifi County.
Some of the cases that were operated on during the week-long exercise were mostly hernias, hydroceles, and goiter.
Now, hernias in children, they could be something related to how you're born, especially in boys. We don't see hernias especially a lot in girls, we see them in boys.
The common surgical cases here is number one, hernias, mainly in men. Number two are hydroceles, which are extremely big. We don't see these in many other parts of Kenya. Number three is prostate diseases, especially the one which is causing obstruction of urine flow.
The surgical services were provided at no cost at all to the patients.
Surgical September was one of those milestones where we were able to bring in very many players, very many people who came out to support us in terms of getting the people to get specialized treatment in various ailments. And I think the department scored a first in getting very many sponsors in many things, very many doctors who came in and personnel who were able to come and help the people of Kilifi.
Young Peter was born with a case of undescended testicles.
Mtoto alianza kugonjeka, nilirealize wakati mtoto alikuwa mdogo, shida zake akawa simuelewi, nikawa namwangalia, nikakuta kuna ile testis yake moja ilikuwa haiko. Sasa nilipompeleka nikaenda Nakuru, upenda Nakuru nikakuta daktari kule, kaniambia ni beta afanye operation irudishwe mahali pake.
His mother could not afford the money to get the operation needed to make him better.
Sawa, wakaniambia nifanye hiyo operation, nikaitishwa pesa ikawa ni nyingi, nikawa sitaweza. Nikaprefer nije hospitali ya Kilifi ambapo wana better services na nikaona wako cheap.
Luckily for them, the Kilifi County Health Department enlisted them into the surgical September camp.
Saidio na Kilifi Hospital, Department of Health, Kilifi, na sasa ndio naongojea operation sasa. Hivi saizi nafurahi kwa sababu tumemalizana na madaktari, nataka kupelekwa ward, ndio niende sasa nipate admission number pale.
What you want to go and do, you want to go to do an operation called orchidopexy. Probably move the testis from where it is lying around the groin area down to the scrotum where it's supposed to be. The operation itself is known as orchidopexy, and I think it's like it's going to be done by one of the pediatric surgeons in our team from Kenyatta.
After a series of tests, young Peter finally got the surgical procedure done by the specialist at the Kilifi County Hospital.
We have had a young boy who had an undescended testis. The young people recover very well, and we expect that within 2-3 days they should be well and be at home.
Na sasa nimefurahi kwa sababu ameweza kuenda vizuri, na amefanyia operation yake vizuri, na ameweza kutoka vyema.
At Malindi Hospital, Mzee Jeffwa was also about to undergo a surgical procedure. He too had been scheduled for surgery, but he could not afford the fees.
Uwezo ndo hatuna, ikabidi tuende mbio huku na huku, tukaenda hata kwa serikali, haikuwezekana.
His procedure went on very well.
Sikuwa na hakika kwamba nitakuwa hai leo. Hapo mahali nimeenda kwa pabaya sana. Nilazwa mbaya sana, kaangalia sasa namna gani. Wanaanza kuniweka kama dawa huku na huku. Wananiosha mambo ambayo sijayaona. Roho yangu ilikuwa na wasiwasi mkali. Sasa wanaanza kunipiga masindano huku kwa kiuno, wanaanza kunipiga masindano kwa kiuno huko, wananisafisha huko. Kwanza kunikata kisu, sasa nikasema leo kwisha. Hata sikujua, nasikia naumea kwa mbali. Sio mbaya, tunashukurani sana. Nilipokuwa jana na sasa, jana nilikuwa tumefika mbali sana. Sasa tunashukuru.
Across the county in Mariakani Sub-County Hospital, Mzee Ngumbao had his surgical procedure done by another team of surgeons from the Surgical Society of Kenya. Kilifi County Health Department has working relationship with private hospitals located within the county.
When the county government approached us with this noble idea, we found that it fits snugly within our mission of giving back to society. And so for the first time, we are having such a camp being run with the local doctors, which I think is a much better and a more effective way of running the program.
This is an initiative that has been key in improving the capacity of the health provision.
With our collaboration with the Kilifi County, Malindi itself, I think they have planned for around 130 cases to be done within the two facilities, which is the Malindi District Hospital and our facility, Afia International.
During the surgical September exercise, the County Health Department partnered with KYM Afya Hospital located in Malindi and St. Luke's Hospital located in Kaloleni to have some surgical procedures done in these facilities.
I'm leading the team that's at Mariakani Hospital and St. Luke's Hospital, but the other teams that are at Kilifi and Malindi. So the teams that are at Mariakani and St. Luke's have I ran into about 140 patients, but the ones after screening, the operations we've had, today they should be towards 50 in 2 days.
We came in on Thursday and we started operating on Friday. They had screened about 180 patients from Mariakani. We are part of them. And it has been a big experience.
The surgical camp's success was coupled with the impact of installation of new medical equipment at Malindi Hospital, Mariakani Hospital and Kilifi Hospital, which have been well received by the residents and have helped the health department to ensure provision of affordable, accessible healthcare services to all.
Previously, as compared to using cassettes, today we're going to use a phosphor plate, which is the most digital component of this machine.
Hii sasa ni mara ya kwanza kabisa kupata mashini na aina hii hapa Kilifi County.
Nikipiga button ile ni yenyewe tu itajigeuza, itajiseti kama vile inavyofanya. Kama jana ilihudumia wagonjwa 35, juzi 33. Kwa hivyo siku hizi nahudumia kama tufanye average ya wagonjwa 30 kwa siku.
Provision of new MRI machines, X-ray machines, ambulances, and various specialist equipment have been purchased by the county to ensure that the health department fulfills its mandate.
Kwa sababu ya afya kuwekwa katika milki ya serikali ya county, leo hii serikali ya Kilifi na wakazi wa Kilifi wanajivunia ambulance zaidi ya 20. Na si ambulance kwa sababu zimeandikwa jina ambulance. Ni ambulance kwa sababu zina vifaa ambavyo vinatakikana kuwa ndani ya gari inayoitwa ambulance.
Hospitali zetu zimeweza kubadilika, ziko na mabadiliko makubwa sana, hali ambayo tutasema inatufurahisha. We have achieved a lot.
Every county has its own privileges and challenges, but I can only just talk of the achievements that we've done as a Kilifi County Health Department. And you cannot compare what was there before and what is now after the devolution, because we've achieved so much as a department in Kilifi County.
The department is procuring a lot of equipment to upgrade the existing hospitals, and also some of the health centers are being upgraded so that they can reach the stage of being hospitals, all in the name of ensuring that we bring the services closer to the people. And I can actually say the county government of Kilifi is so committed in terms of ensuring that its people get the best in terms of health service delivery.
The county government of Kilifi has a deliberate program of equipping our hospitals with diagnostic equipment, and also to ensure that we have the personnel and the reagents and all the non-farms available to ensure that any kind of ailment available in this county can be treated here without having to wait for surgical September. Currently, if we go to the hospital, we have a new digital X-ray. At least we have 3 in the county. We have 1 in Malindi, 1 in Mariakani, and 1 here in Kilifi. We have installed 3 new CT scans here in Kilifi, in Malindi, and Mariakani.
Patients no longer have to travel outside the county to seek such services.
Leo hii watu wanatoroka private hospitals, wanakuja hospitali za serikali ya Kilifi County kwa sababu zina vifaa bora kushinda hata zile hospitali za private zinazopatikana hapa Kilifi. Hayo ndio matunda ya ugatuzi.
To ensure the scaling up provision of essential healthcare services, the county is pumping more resources into the health sector to ensure good provision and management of healthcare services.
More so, we are keen on procuring equipment and hiring of medical workers. Without human resource and equipment, then those buildings will be of no use. So we've actually concentrated our resources on equipping these facilities and hiring more staff.
Kilifi is one of those counties that is seen as a poor county in terms of poverty indexes that are given. Therefore, disposable income to transport someone to the nearest, to the farthest hospital is still a problem. So what we're looking at is bringing health facilities. We want to have at least a health facility in every location within the county. That is 1. 2, we also want to ensure that the maternity is provided at the nearest place so that mothers don't have to travel long distances. Owing to the fact that our roads are not the best, although we are working towards ensuring that because you see that Kilifi is a very vast county, probably the 6th largest in the country. For somebody to look at a health facility that's verified becomes a problem with the person, but we are looking at providing health facilities and service delivery to the nearest less than 5 kilometers.
In the area of human resource, the county is hiring more doctors, clinical officers, pharmacists, lab technicians, and caregivers to improve services in hospitals.
Tayari tumetangaza kuajiri madaktari katika vitengo tofauti tofauti, ikiwa ni upasuaji, ikiwa ni watoto, ikiwa ni uzazi, tumetangaza.
The county has been able to employ more doctors. That is, before it used to have at most 2 doctors, but now we have 12. Also the nurses, we used to have 25, but now we are 43. So it is positive. And another thing about access is the referral strategy, whereby the county was able to purchase or rather distribute ambulances. We used to have 1 ambulance, right now we have 4. One is not operational yet, but we are going to use it. So we can pick patients from the peripheries to this place. Before we could not do that.
Months after their surgeries, we caught up with young Peter, who has now made a full recovery and is as healthy as ever.
Nashukuru kwa sababu mtoto alipata nafuu, akapona vizuri, na mtoto kuanzia hapa akakuwa active, na pia kutembea kwake before operation ilikuwa ni shida, hawezi tembea muda mrefu, na baada operation anatembea long distance, achoki tena yakimbia mbio.
All this couldn't have happened without the county government's interventions.
Sasa hiyo nashukuru kwa operation ambayo alipata kule, huduma ambayo alipata kule Kilifi. Na nashukuru madaktari ambao walimshughulikia mtoto.
Afya bora kwa jamii ndio utajiri wa jamii yetu. Ama kaunti yenye kutoa afya bora ndio kaunti ambayo italeta utajiri kwa jamii. Tunajaribu kama kaunti kuhakikisha kwamba hazina ya afya inatoshea mahitaji ya jamii.
As for Mzee Jefwa and Mzee Ngumbao, they are on their way to full recovery, and they are thankful to the health department for bringing services like this closer to people like them.
Nasikia raha kwa sababu vile nilivyokuwa nilikuwa niko hali mbaya, hata nilikuwa sina matumaini sana kwamba nitakuwa wakati huu bado niko hai. Yaani wameanza Mariakani, wakaja Kilifi, wakaenda Malindi. Kwa hivyo ninashukuru msaada huo niliopata, ni kumshukuru Mwenyezi Mungu.
Nimekaa kama miezi minne hivyo, na siku nyingine juu kidogo, nasikia uzuri sana. Katika maumivu yote nilimwambia kwamba alikuwa sijapata. Kaanza kuendelea na hizi kazi za kulima katika shamba hivyo.
Mamangu ndo alikuwa mwenye shida ya tezi kwa muda wa miaka 8. Tulikuwa tunaandikiwa clinic Mombasa, lakini hatukuweza kufanikiwa. Na jana ndo akaanza hiyo shughuli hapa Kilifi District Hospital. Mamangu amechukuliwa akafanywa jana operation, alikuwa na tezi hapa kwenye koo. Na sasa hata tuko kwa wodi, bado anapata matibabu, na hali yake pia naona inaendelea vizuri, na ameamka sahihi, na hata ameanza kula, kwa sababu niliona labda hataweza kumeza tena, lakini Mungu amemsaidia. Sasa anaendelea vizuri na anaendelea tu na madawa kama kawaida.
Nimekuja hapa hospitali kwa sababu ya matibabu ya bure, upasuaji wa bure. Kwa hivyo ninashukuru kwa yale niliyofanyiwa matibabu ya bure, ninashukuru Mungu.
They are going for regular checkups at Kilifi County Hospital to make sure reinfections don't occur.
Post-op ni ule contraction. Kuna hernia pia, post-op ni nani?
Following the success of the first surgical September, the county health department is holding another one this year, which is going to be bigger, well organized and more effective.
Tukasema kila mwaka tutakuwa na zoezi kama hili, ili mwakani ikiwa kuna cases ambazo hazikupata matibabu ama hazikushughulikiwa katika hospitali zetu, tunatangaza wiki moja ambazo zile cases zote ambazo bado ziko kule vitongojini tunazileta pamoja na zote zinafanywa, huduma inapeana.
This second intervention will help address the challenges facing the quality of health services, which is a key goal to ensuring the county achieves international healthcare standards where preservation of life is paramount.
The success of that camp has actually motivated many more experts, and we've had expressions of interest of other partners wanting to come in to be able to be part of that activity.
Next year, September, we want to do it in another sub-county, so as at the end of the period we reach everyone. And this is not a one-off. We are not looking at it as a one-off. We want to be able to do this every year. And from this activity, it's the first time we're doing it, but after this activity, we expect that from here we start the resource mobilization for the next activity.
Kilifi County, we are proud to have donors who really support us. And the donors also are willing to partner with the Department of Health. This is a key message to the department that we have people who are ready to work with us.
I thank the county leadership, the governor, Honorable Kingi, and his team for giving us this opportunity to at least to come and serve the people of Kilifi County. And also to thank our sponsors. Kenyatta National Hospital has always been with us every time. Gertrude's Hospital, Kikuyu Hospital, and among the Upper Hill Medical Center, and among the pharmaceuticals, Harley's Limited, for enabling this activity to be successful.
The Kilifi County Department of Health is in the process of finishing up the construction of a warehouse at the Kilifi County Hospital compound. This is to create a functioning storage system that tracks availability of medicines and consumables like gloves, needles, and bandages to all health facilities.
This warehouse is going to store commodities in what we would categorize as pharmaceuticals and non-pharmaceuticals, plus other small equipments that we always procure. The essence here is to be able to manage stock at this county central level so that distribution is actually easier. We are able to anticipate, we are able to forecast.
The warehouse will allow immediate transfer and sharing of medicines among health facilities in the county when need arises.
There's a big project that is coming up, ICU and accident emergency, that we are already underway doing. Hopefully it will kick on at the start of 16-17.
There is an ongoing process facelifting health centers and equipping facilities handed over from the Constituency Development Fund to help provide clean, quality and affordable services.
We are rehabilitating all these facilities and also equipping them to be able to operationalize these facilities. And in fact, in this current financial year, we've already started refurbishing 10 of these facilities, and soon we will be able to make them operational.
And we have come in as government and we're faced with this because the facilities are there, they've been put up. But how do you start opening them? You need a doctor, a nurse, and several personnel. Then you need supplies to that. So you see our budget is very high because we intend to open by the end of this next financial year, 2016-2017, to open all those facilities and put personnel and have them functioning.
We are concentrating our resources on things that will outlive even our existence here. And it is our hope that the first 5 years of this county government will create a good foundation for this county in the years to come.
Kilifi County. A healthy county is a wealthy county.